told you won't be seen for 6 months or 9 months or 12 months. We don't want that to happen. And I suppose one of the things in relation to the Maskey report and the fact that the Mental Health Commission are doing a review, the HSE are doing an independent audit, we will have a lot of information coming through early next year in relation to the review and the audit and the 73 teams that we have in place, and it'll give us invaluable data that we never had before. So thank you, Deputy. I hope I answered all your questions.
Okay, thank you. Holly Kearns.
Thank you, I think that the overlaps between disability, mental health and old age are complicated, and it's important for the committee to take time to discuss this theme. And I thank the Minister for attending today. Mental health falls under the Convention on the Rights of People with Disabilities, which gives people with mental health conditions additional protections and rights. Also, as people age, they can develop disabilities which present different types of challenges. The Convention on Rights of People with Disabilities gives the right to live independently in their communities, while the Programme for Government commits to introduce a statutory scheme to support people to live in their homes. However, the reality is very different, with more than 6,000 people on waiting lists for home care. That's this year alone, and there have been over 1,000 delayed discharges from hospitals directly linked to home care shortages. Part of the staff shortage problem is that massive responsibility is placed on home support workers, who are often the lowest paid workers. As part of your plans to improve the provision of home care, and you mentioned the funding allocated, but what is being done specifically to support the support workers in that allocation? Also, there's a creeping kind of privatisation of the sector, and I wonder what you're doing to stem that, Minister. An issue of concern is the continuing lack of regulatory framework or independent regulator for this sector. In your opening statement, you mentioned the development of regulation for home support services, but could you give us an idea of what that will look like, and will it involve an independent regulator's office or something to that effect? The committee recently heard about how interaction between community healthcare organisations, CHOs and mental health services can negatively impact the quality of life, increase rights restrictions placed on disabled people in the community. For example, individuals having to stay in mental health acute units, sometimes over very long periods of time because there isn't appropriate supports. Core to this issue is the structure of the HSE with disability services and mental health services operating off different budgets and systems with a lack of cooperation, and unfortunately teams then arguing about who should take responsibility for an individual, and this committee has received examples of these cases. You also have to be aware of them, Minister, so I'm just wondering if you could share your response with us. And currently under the Assisted Decision Making Amendment Act, treatment decisions are being removed from enduring power of attorneys. This means that people will now be forced to go through two processes at a potentially difficult time. For example, members of the Irish Dementia Working Group have pointed out that shortly after receiving a diagnosis of dementia, individuals will have to draft two separate instruments with different requirements for supporting evidence and witnessing, etc. And this is especially burdensome if the relevant person wishes to authorise the same person who holds the enduring power of attorney as their designated healthcare representative. As Minister for Older People, what are your thoughts on that issue? And this question is for the Department of Health officials on the national policy on access to services. I'm wondering if you could provide details on how integrated it is. For example, in West Cork at the moment we have a situation where young people are at risk of not being able to access day services because there's no suitable public transport. So ultimately it's all well and good to have kind of the models of care, but how well integrated are they? And just a final question in relation to the ADHD app, which has been mentioned a lot. I'm just wondering what it's called for anybody who's watching who might want to know more information about it. Thank you.
Thanks, Holly. Minister.
Thanks, Deputy, and I'll try and get through as many as I can, and if I forget any, please come back to me.
Thank you.
I think your first line was it is a complicated area because there is huge overlap as well. And you know, I was struck by, you know, said earlier, just because you're an older person doesn't mean your disability fades away or it falls away. So what are we doing for home support workers? So I'll go back to the Strategic Workforce Advisory Group again, and the 16 key recommendations, and the recommendations we took on board, every single one of them. So we worked with engagement with the public, private and the voluntary sector. We work cross-department departmental, because these recommendations, they have to be enforced across all of the departments. So the first one is that when the HSE are outsourcing hours to the private sector, that the minimum wage, the living wage would be the minimum wage paid to anybody working. So the current minimum living wage is €12.90. It's going up next year, but that was one of the key recommendations, and everyone bought into it. The second one was that there are some people who work for private providers, and they tell me this themselves, that their mileage is not always passed on to them. So a second recommendation was that mileage would have to be paid and passed on to the worker. Another recommendation was that the provision of home care would come back to a 50-50 split, public and private. So previously it was always a 50-50 split, but because of the extra 150 million that was secured over the last two budgets, and the fact that we delivered over 2 million extra hours last year alone, up to 20.9 million, we had to depend more on private companies. But one of the recommendations in the Strategic Workforce Advisory Group is that we move quickly back to a situation where it's a 50-50 split. That's what I want to see. So we are also asking all the 9 CHOs to have a recurrent recruitment campaign. But the point I made earlier was the terms and conditions for home care workers working in the HSE are better than some of the private providers, and yet we're still challenged trying to recruit through the HSE. So it is there are challenges there. We want to increase the direct provision of home support provided by the HSE. We don't want to see, as you know, for example, nursing home care is an 80-20 split, 80% private, 20% public. So we do want to see in relation to home care provision. So that's what we're doing to try and support workers. But one of the other recommendations is that home care would be seen as a viable career pathway. So you would come in with your level 5 QQI, but you could progress the whole way through, if you want to decide that you just didn't want to be, that you wanted to do more in relation to caring for people, that you could take on additional courses, that you could take on additional skills, and that you would be encouraged to do that and supported as well. And I think that's really important that we do that. In relation to reform of the regulatory framework, and this is really important, so in January of this year, in recognition of the need to reform the regulatory framework, we determined a two-phased approach to examine the primary and the secondary legislation. So we've undertaken a national nursing home experience survey, which is undergoing at the moment, because we felt, so there's a real link between nursing home care and home care, because healthcare workers are providing it and nursing staff. So we've put in place a national nursing home experience survey, but also what I did as well is I put in place a patient advocacy service. So we now have a situation where PASS, for example, and we have funded them, that they're going into nursing homes and they're meeting with the residents and they're hearing if they have any concerns, in relation to any type of abuse. It could be emotional, it could be physical, it could be financial. So we're just trying to make sure that those supports are there. So that's something we have that we're rolling out. In October of this year, the government approved the drafting of the Health Amendment Bill to provide for the initial enhancements across the two schemes. I hope to move that legislation. So basically, in simple terms, it will be standards and best operating procedures for home care across public, private and voluntary. We don't have that in place yet, and it's part of making sure that we have a standardised approach for everyone receiving home care, regardless of where you are in the country.
So just before we move off of the home care model, am I right in thinking, so what's been done in order to support specifically the support workers is just to ensure that they get the minimum wage? And then
no, not the minimum wage, the living wage.
The living wage.
The living wage, because that's not, and that has been welcomed across all the sectors, that they receive a minimum of the living wage, that they also receive mileage when they are delivering home support. And I just want to point out, in North County Dublin, for example, I'm not sure what CHO it is, North County Dublin, 9, CHO 9. CHO 9, we're talking about public and private. There's an organisation in CHO9 that I met a few months ago, and they provided 900,000 home care hours last year. There is no waiting list, and they're a voluntary organisation. And they support a lot of their care. They don't have to travel in between. So if you're living in rural areas, as you all know, you'd have to travel. But a lot of their care is provided by walkers, they call them, and they even actually provide a shoe allowance every quarter for their home care providers. And I think there's an awful lot that we can learn from them. They pay a Saturday rate, they pay a Sunday rate, and they pay a bank holiday rate. And it's one of the best performing areas, CHO9, and the care is provided by a voluntary organisation, and I think there's an awful lot we can learn from it.
There clearly is. In relation to the private sector, you say it's 50-50. I'm wondering just what's been done to stem that growing dependence on the private sector.
So when I came into post, there was 9,000 people waiting on home care, and we got the numbers down to 4,000.
Through the private sector?
No, through both. So through both, because at the end of the day, a person who needs home care, they don't really care who's bringing it in, who's bringing the home care in once the home care comes in the door. And what we're doing is, previously it was a 50-50 split. So there was 50% of home care being provided by the HSE and 50% being provided by private companies and voluntary, like the organisation that I just spoke about. I received additional funding in the budget, in my first budget of 150 million to deliver extra home care hours. So obviously the HSE are recruiting, but the problem we have with recruitment in the HSE is that a lot of their carers are older, and a lot of their carers, through natural retirement. So a lot of the people we brought in, we also had people, natural progression, that they were retiring at the same time. So we had to reach out to the private providers, and in fairness to them, they did step up and they provided more hours. So where we are at the moment, we have a 60-40 split, but one of the recommendations in
60 private or 60 public?
60 private. So it went from 50-50 to 60-40, but one of the recommendations in the Strategic Workforce Advisory Group is that we would move it back again as best we can to a 50-50 split, and we have asked all 9 CHOs to put in place a recurring recruitment campaign in relation to healthcare workers. But the point I'll come back to as well, some people have moved away from healthcare. Some people who were healthcare workers no longer want to work in that space, and we are doing everything we can to try and support workers in that space and to try and make it a really viable career pathway for them.
And do you see that it getting back to 50-50?
That's my aim. Yes.
What kind of timeline are you looking at for that?
We don't have a timeline on it, but we are going to be working out the timelines and all the recommendations very, very shortly. But again, what I'm saying is, many of the CHOs are recruiting at the moment, and they're finding it difficult to recruit staff, even on €16 an hour plus mileage, and we're seeing that across the board.
And in terms of regulation of home support service, will there be a kind of an independent regulator or anything like that? Is that what you're looking at?
So what we're putting in place is we're putting in place a home support office in Tullamore, one national home support office, which will be, I suppose, the hub, and then there'll be 9 spokes, for example, that will be going out to the 9 CHOs.
But no kind of regulator.
Well, HICWA are the regulator. HICWA are the regulator, and we will continue to work very, very closely with HICWA.
Thank you.
Sorry, there was a question,
yes,
wasn't
sorry,
there?
I beg your pardon.
Yeah. No,